Dear viewers, welcome to today's episode of Visite. I hope you all had a wonderful day. And I dedicate myself to an email today, which I think was a very interesting topic, so that many people will be interested, and where many people are also wronged, because what they suffer from is not medically understood today. And it's a question from a 62-year-old patient, and she describes, I've been sedentary all my life. I'm a bank clerk, but I'm quite a happy woman. And as far as I can tell, I was always in a good physical and mental situation, and I always felt healthy. In 2017, however, there was a rear-end collision. This rear-end collision by another car then led to whiplash immediately. Of course, I was immediately treated both orthopedically and physiotherapeutically at short notice, and the initial muscle neck discomfort was actually declining in a relatively short time and with intensive care. So after a short period of incapacity to work, I was actually able to find my way back to everyday life. But 2.5 months later, it actually started very slowly and became more and more intense. I had leaden heaviness over my eyes coupled with tiredness. I became so sensitive to light, even drafts no longer did me any good, and realised that I wasn't resilient anymore. I developed stress intolerance. The complaints increased, especially when I positioned my head improperly in any way, which was abrupt or an unfortunate turn of the head. The diagnostics, both ophthalmological, orthopedic and on part of neurologists, did not yield any pathological findings. It's been more than 4 years now, and I face my complaints with a great helplessness. But I can't shake the thought that it was related to this accident. Before I get to the explanation, I would like to send something ahead. We're talking about the cervical spine here, and the cervical spine is a so-called eye of the needle, a needle between head and body. I think it's kind of brilliant that we just have relatively few problems in everyday life, and how the body copes, can hold ourselves in this constant upright posture, but also to grant this passage daily and unhindered for us. The head has 2 strong functional units which are realised by the 7 cervical vertebrae. The first cervical vertebra is the one that carries the head. That's about 2 or 4 to 6 kilograms. And with the atlas, we can only do this tilting movement. There are no intervertebral discs in the area of the upper 2 cervical vertebrae. The other is the so-called axis, which is the second cervical vertebra. And the second cervical vertebra has such tooth joints and is connected to the atlas with a wedge, and is responsible for turning movements of our head. That's why it's so important that when you also have a monotonous posture in everyday life, that you just know that the head, the mobility of the head, and also the mobility to 90 degrees of the head, always shows that the muscles that move the head to the left, these muscles contract and those have to stretch. If I now turn my head in the other direction, these have to pull and the others have to stretch. This means a head movement in all directions means that I have a relaxed and good musculature, which of course in its serenity allows a good passage for what has to go through this eye of the needle. I think you can also internalise that a little bit if you just basically tilt your head 45 degrees. How there's already a certain basic tension back there, and the body has to adjust to it. And of course it therefore has long-term problems. But that's actually far from it. The problem is that these so-called proprioceptors, they're such small signal receivers, stimulus receivers, and we say for every gram of muscle tissue we have over thousands of such little signal receivers. And these small signal receivers pick up all the information that comes from pressure, from impact, from weight, from stretching, from vibration, and also from injuries of these two joints. When the head gets in such a position to be thrown backwards and then forwards, unphysiologically to its normal load limit, then the head joints or the muscles are not able to stretch and contract again like a rubber band. But it causes a so-called ligament instability or muscular instability in the cervical spine. This is not visible on CT or MRI because damage to the intervertebral disc cannot be ruled out. I don't just mean that we don't have any discs in that area, but it's not any symptoms of a herniated disc, but that can also happen when, for example, being intubated during general anaesthesia, that the head is positioned unfortunately. I think you all know that if you sleep somewhere else and the pillows are different, as you get up in the morning, you say somehow, I displaced something at night. I somehow have a tension that has built up here. There are also blunt sports accidents. There are also household accidents. These are accidents. The child can fall off the changing table. The child has fallen unluckily from a bicycle or a scooter. In childhood as well as in adulthood. So you should also, as part of the diagnostics, take a lot of time to question things that maybe people are not even aware at the moment that a permanent nerve irritation is triggered since. And if this nerve irritation is triggered, the body responds with nitric oxide activity. This nitric oxide is a substrate produced by the body itself, which it needs to detoxify well intracellularly. It has an antibacterial, antiviral effect. Nitric oxide is responsible for our vascular tone. But if this nitrogen monoxide is also formed massively every day, then there is a giant overload, and that has in turn a negative effect on mitochondrial energy output. And that's actually the key of the whole thing. Through this so-called high nitrosative stress, the diagnosis of chronic cervical spine instability means you, of course, have to say, please, also, those who may not have had an accident like this before, please take care in these ball sports. Volleyball, handball, there's a lot of that. Unconscious, sometimes excessive demands or impact or shock happening to the cervical spine. Bungee jumping or all these daring leisure sports Please always keep this in mind if you have multiple illnesses triggered, whether in the past this type of accidents could have taken place. General advice, which can of course also stabilise a sensitive cervical spine, is that you are very careful in the context of such ball sports as volleyball, handball, basketball, but also this somewhat dangerous bungee jumping. If you have an unstable cervical spine, then you really shouldn't be doing such sports. The other is that the neck muscles with a certain sensitive cervical spine, or even not very strong neck muscles, the entire ligaments and muscles can be strengthened. And you can check out these guides and have them explained to you by subject-specific orthopedics, physiotherapists, or from manual therapists, chiropractors, or osteopaths. An unbelievable return to a good and strong musculature is possible. And the third thing is that you ensure to also have a really good sleeping position for the head, really adapted to your stability or instability of your cervical spine. Of course, if we now go back to you and recognise the problem and now expect a subject-specific diagnostic clarification as well as therapy, I have to tell you that the professional code actually says that every colleague is not able to diagnose and treat in an interdisciplinary manner. That's the professional code, and that's why we get into this situation. What we don't see, that's not there, and the connection in these areas doesn't meet. So we get from one tunnel vision to the other tunnel vision. The orthopedist looks at the morphology, takes the X-ray, does the MRI, does the CT, actually sees the structures of the musculoskeletal system, and then actually can't understand that in any way the nerves, the ears, the eyes, or something is related. Of course, the ophthalmologist clarifies intermittent visual disturbances, and of course there is no explanation for this in the eyes. And neurologically, you try to understand the causes, and you can now check for paralysis. You can clarify epilepsy, whether it's there or not, or whether it's tinnitus, but that doesn't actually help you any further. And they say this cervicobrachial syndrome, that's what it's called, is usually not taken seriously by orthopedists and accident surgeons because it's healed after some time. And when it has healed, because there is a corresponding period of time between the accident and today, then the cause is actually seen very quickly in psychosomatics or a request for a pension. And I think that is very, 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 very sad. And also this neck instability, which again and again, of course, through the nitric oxide and in the binding to proteins provokes slowly, but also really steadily slowly, multi-organ symptoms, and this lack of energy supply now includes the immune barrier. That is, there is an immune deficiency. It may be related to viral reactivation, bacterial reactivations, exhaustion, chronic exhaustion going all the way to cardiac heart pump failure, so valvular heart failure. On the part of the ENT, one sees again and again chronic, perhaps sinus infections. The ophthalmologist says you have high pressure in your eye. The dermatologist says you may have atopic eczema. The neurologist speaks of a migraine and headache. The rheumatologist of unclear joint problems. The orthopedist of the cervical, thoracic and lumbar spine. So meanwhile, via the muscle chains, there is already a systematic spine problem. The gastroenterologist can confirm heartburn, meteorism, so a lot of flatulence, indigestion, and the cardiologist, as I already said, cardiac insufficiency, but also blood pressure or cardiac arrhythmias. The urologist finds a chronic latent cystitis. Mr. Dr. Kuklinski from Rostock wrote a wonderful book on cervical spine instability, and what really impressed me at the time was that I think he listed symptoms and clinical pictures on 4 or 6 pages from A to Z, all of which go back to it. And that kept me incredibly busy back then as a young doctor. And of course I asked myself, what do I have to do now? How can I lead people out of these processes? And you also need functional diagnostics at that moment. That is, if you x-ray a person, if you do a CT now, do an MRI and they're lying down, then it will actually signal a normal state to you. But if you take a Sandberg x-ray with the mouth open, and then with the right and left movement, then you see how these processes then map respectively. A functional diagnosis, that is the upright MRI, can also show significant inflammation and irritation here. In the clinic, we use a simple laboratory test. That's the S100. S100 is a parameter for the blood-brain barrier, and this parameter tells us indirectly whether the blood-brain barrier is open, whether the glial cells or also the nerve cells, peripheral nerve cells, could be damaged. And I think the other thing is possible for the normal family doctor. Without any problems, please have the nitrosative stress measured. And then you have unbelievable measurement data in the morning urine alone. For example, the elevated citrulline, which is an indirect metabolite and increased nitric oxide exposure. Or, for example, methylmalonic acid as a benchmark for an intracellular vitamin B12 deficiency. And then it really doesn't do much good to see that maybe the B12 in the blood still has a normal level. But I also observed that when the level is at the lower limit and still within the reference range, that this is put aside and it is said vitamin B12 is fine. The reference range must be exhausted to the upper limit. One has a better statement about the intracellular B12 situation when measuring methylmalonic acid in urine. And then there's the nitrophenyl acetic acid, the measure of this peroxynitrite formation. But the profile itself is called nitrostress profile. And if that's too expensive for you, you can only have the methylmalonic acid measured in the urine first and thus get an indirect information. I already indicated the therapy of such a cervical spine instability. This is really taking matters into your own hands and really making sure that the cervical spine is also physiologically strengthened by the corresponding physiotherapy program. But even if you walk every day and walk as briskly as if you have quietly and secretly taken something with you, then no one should see that you're not walking and running. But you walk briskly, that makes an incredibly good stability of the cervical spine. This is also called isometric training by the appropriate therapist. But make sure if methylmalonic acid is elevated, substitute vitamin B12. Medicine suggests as a depot 1,000 micrograms per month. We give 5,000 daily for a few days. to buffer the generalised system, which, of course, has an unbelievable number of billions of cells, and each one has to be really fed here and then go down to 1,000 micrograms a day afterwards, and then only every 2 days, and then only twice a week, and then only every 14 days. And we can then monitor that well with the methylmalonic acid. And not to be underestimated for our whole mitochondrial energy metabolism, please, of course, substitute B vitamins. We need copper, we need zinc, we need magnesium, we need minerals. And these are things, omega-3, which of course are very valuable there. But as I said, this book by Dr. Kuklinski, I can recommend it to a layman, but this should be in every family doctor's closet, because everything is about understanding. And if we don't understand why this person is suffering, and maybe we know them from before, then we should not stop as doctors to find and search for ways to understand and hold the diagnostics tools in hand to help this person. With this in mind, I wish you all a wonderful day or evening. Have a great week, everyone, and I'm really looking forward to the next episode of Visite, when we'll see each other again. Thanks.